Electrodiagnostic testing in dogs with disorders of the spinal cord or cauda equina. Introduction. Electrodiagnostic EDX testing is a tool for assessing the functional integrity of the nervous system. While its use in veterinary medicine is more common for evaluating neuromuscular disorders, EDX testing can also provide valuable insights into diseases of the spinal cord and cauda equina in dogs. These tests can complement imaging findings, offer additional diagnostic information, and, in some cases, proceed more advanced diagnostic modalities to determine whether a dog's clinical signs involve the spinal cord or cauda equina. Despite the availability of advanced imaging techniques like MRI and CT, electrodiagnostic tests have their place in situations where the etiology of lameness or neurological dysfunction is uncertain, or when evaluating conditions that affect neuronal tissue, but aren't easily visualized through imaging alone. This study outlines various electrodiagnostic techniques used in dogs with spinal cord diseases or cauda equina syndrome, such as motor evoked potentials, MEPs, somatosensory evoked potentials, SSEPs, cord dorsum potentials, CDPs, F-waves, H, reflexes, electromyography, EMG, motor unit number estimation, MUN, and nerve root stimulation. Motor and somatosensory evoked potentials, MEPs and SSEPs. MEPs, motor evoked potentials. MEPs assess the integrity of descending motor pathways. In dogs, MEPs are recorded from muscles such as the extensor carpi radialis for the thoracic limb or the tibialis cranialis for the pelvic limb after stimulation of the cerebral cortex. The stimulation can be electrical or magnetic, and the most common method in clinical practice is transcranial magnetic stimulation, TMS. TMS involves applying electrical current through a coil positioned over the skull, generating a magnetic field that depolarizes the motor pathways in the brain. These signals travel down the spinal cord and result in muscle depolarization, which is recorded as an MEP. MEPs provide several useful parameters such as threshold intensity, latency, amplitude, and wave configuration, offering insights into the functionality of the pyramidal and extrapyramidal motor tracts. Clinically, MEPs are particularly helpful in dogs with thoracolumbar intervertebral disc extrusion, TLIVDE, even in dogs with mild signs like back pain. MEP abnormalities, such as prolonged latency and reduced amplitude, are commonly observed and may help differentiate between neurological and orthopedic causes of lameness or pain. SSEPs, somatosensory evoked potentials. SSEPs evaluate ascending sensory pathways by recording the electrical activity generated in the somatosensory cortex and spinal cord after stimulating a peripheral nerve. Commonly used nerves in dogs include the tibial nerve, sciatic nerve, and ulnar nerve. Electrodes placed along the spinal cord and brain record the propagation of the sensory signals, which are then analyzed to provide data on the latency, amplitude, and conduction velocity of the evoked potentials. Similar to MEPs, SSEPs are sensitive in detecting sensory deficits, even in cases where dogs are still ambulatory. SSEPs have shown particular utility in conditions like cervical spondylometallopathy (CSM), where they can differentiate between affected and unaffected dogs. In dogs with degenerative lumbosacral LS disease, SSEPs have also been used to assess sensory function. Even in dogs with mild clinical signs such as pain or lameness, clinical applications of MEPs and SSEPs. MEPs and SSEPs are sensitive to neuronal tissue injury and can provide valuable diagnostic information in dogs with spinal cord disorders. For example, dogs with back pain secondary to TLIVDE exhibit abnormal MEPs and SSEPs compared to healthy controls, and MEPs can help determine the severity of spinal cord compression. Additionally, SSEPs have been shown to differentiate between dogs with LS disease and those without, making these tests useful in diagnosing cauda equina syndrome. However, in severely affected dogs, such as those with paraplegia due to TLIVDE, MEPs and SSEPs may not be as useful since these tests are often absent in cases of severe spinal cord injury. Cord dorsum potentials, CDPs. CDPs represent the electrical activity of dorsal nerve roots and neurons within the dorsal horn of the spinal cord. These potentials arise from sensory input and are purely sensory events, providing information about the proximal portion of the peripheral nerve in the dorsal root entry zone. In dogs, tibial nerve stimulation is most commonly used to generate CDPs, which are recorded from electrodes placed over the L4, L6 region of the spine. Similar to SSEPs, CDPs are evaluated based on the latency, amplitude, and configuration of the recorded potential. CDPs are particularly useful in evaluating dogs with LS disease, where they have been shown to detect abnormalities in dogs experiencing pain from foraminal stenosis. CDPs may also help differentiate between orthopedic and neurological causes of hind limb pain in dogs. F-waves and H reflexes. F-waves and H reflexes are late responses generated after stimulating a peripheral nerve. They provide insight into the proximal nerve segments, ventral roots, and motor neuron excitability. F-waves result from antidromic conduction of motor fibers to the spinal cord, followed by orthodromic conduction back to the muscle. F-waves can be recorded from various muscles, such as the plantar interosseous muscles after stimulation of the tibial nerve. F-waves are particularly helpful in diagnosing cauda equina syndrome, where prolonged latency and increased F-wave duration have been associated with more severe motor deficits in dogs with TLIVDE. H reflexes. The H reflex is similar to the deep tendon reflex and is elicited by stimulating a sensory nerve, which sends signals to the dorsal horn of the spinal cord. From there, the signal synapses onto motor neurons, causing a response in the corresponding muscle. The tibial nerve is commonly used to elicit H reflexes in dogs, and the reflex is evaluated based on latency, amplitude, and duration. Clinical applications. In dogs with cauda equina syndrome, both F waves and H reflexes can be useful in detecting proximal nerve involvement. F waves have been shown to detect foraminal stenosis, and abnormal F-wave parameters can indicate motor neuron hyperexcitability in dogs with acute spinal cord injury. H reflexes are more commonly used in dogs with chronic spinal cord injury, where they may provide insights into motor recovery and treatment response. Electromyography (EMG). EMG evaluates the electrical activity of muscles and can be used to detect denervation or myopathic changes. EMG abnormalities, such as fibrillation potentials or positive sharp waves, can indicate muscle denervation, particularly in conditions like LS disease or peripheral nerve sheath tumors, PNSTs. EMG is also valuable in distinguishing between neuropathic and orthopedic causes of hind limb lameness. In dogs with LS disease, abnormal EMG findings have been reported in muscles innervated by the cauda equina. Additionally, EMG can help assess the extent of nerve involvement in dogs with PNSTs and assist in determining treatment options. Motor unit number estimation (MUN). MUN provides an estimate of the number of motor units in a muscle or muscle group. This technique is useful in assessing the integrity of lower motor neurons, LMNs, and their axons. In dogs, MUN has been used to evaluate motor unit loss in conditions like degenerative myelopathy (DM), where it can provide insight into disease progression. Nerve root electrical stimulation. Nerve root stimulation allows for the evaluation of motor nerve conduction at the level of the nerve roots. This technique has been described in dogs for assessing the L7 nerve root, offering insights into cauda equina involvement. While less commonly used than other EDX techniques, nerve root stimulation could be valuable in diagnosing LS radiculopathies. Conclusion. Electrodiagnostic testing provides valuable functional information in dogs with spinal cord diseases and cauda equina syndrome. By complementing anatomical data from imaging techniques like MRI, EDX tests can offer additional diagnostic insights and help guide treatment decisions. Further research is needed to standardize these techniques and explore their full potential in veterinary neurology.